At this time, I would like to welcome everybody to this morning's program. My name is Leonid Lenny Orlov. I use he, him, his pronouns and identify as white. And I'm with the Human Services Department with the Age Friendly Seattle program. Today, we're going to meet Marwa Sadiq. And instead of Yahya Al-Garb, we are going to check him today with somebody else from the organization. It's Mohammed Akmush, who has gracefully agreed to join us. You'll get to meet Mohammed in a little bit here. And also, as usual, we will get a brief update from our partner, the Seattle Public Library, and also learn about COVID-19 and other resources in your community. Before continuing, I would like to acknowledge the indigenous land that the city of Seattle is on. At Seattle Human Services, we acknowledge that we are on the traditional land of the first people of Seattle, the Duwamish people, past and present. We honor with gratitude the land itself and the Duwamish tribe. Please visit duwamishtribe.org to learn more about the Duwamish, people of the inside who are still here, and find out how you can get involved. Right now, if you can see the screen, you can probably see and read the words thank you on this slide. You can actually see pictures of every presenter, 47 of them in the word thank, that's from 2020, and 19 in the word you, and that's folks that have joined us, including today. I don't have yours, Mohammed, I'm sorry, I never got your picture, but we'll get you a video. And these are the folks that joined us in 2021. And this program was created specifically when the pandemic started, and we were hoping to help people stay connected. The pandemic is not over, and we'll talk more about that, but we are, this is the very last close to home ever. It's been a great privilege to host all of these amazing community leaders and friends over the past 20 months or so. And, I'm gonna miss pouring my heart and soul into producing these shows. But we're not going away, not completely. Age Friendly Seattle does plan to be back on the air in 2022, just in a slightly different format. So if you stick around to the end, you'll get more details on what that's going to look like. And I want to thank you presenters, you panelists, you moderators, you viewers for being here. We love you, and we, wish you only the best. And speaking of thanks, one organization, or rather one entity that we are so thankful for and couldn't do this without is the Seattle Public Library. Our agent in charge of age friendliness at the library, Nancy Sloat, is always here every single episode to help us understand what is happening at the library, what their road is. Are there any, twists and turns on the road to reopening? And Nancy's here today. And Nancy, thank you so much for your partnership, in particular for the library's support of these programs, both when we were in person and we're hopefully going to be in person again back at the Central Branch. More on that later. So what is happening at the library? Please take it away. And if there are any questions, folks, go ahead and type those in for Nancy, and we'll see if we can get to those before the end of the program.
Oh, great. Thank you so much, Lenny. And good morning, everyone. So I am the Older Adults Program Manager at the library, as my slide shows. And I create programs and services to make the library age-friendly and accessible to everyone. And for those of you who've maybe been to our other age-friendly coffee hours or close to homes, I always give a short update on the library as we continue to open up, and also sort of talk about things about the library that you may not be aware of, things sort of beyond the books that we have and the collections that we have. So I totally appreciate our partnership with Age Friendly and Seattle Aging and Disability Services. And I have learned so much over the last 2 years as well as a community member, and I can pass that on to staff and other patrons at the library. So can I have the next slide? So yes, all of our branches are now open. They've been open for a little over a month now, every single branch, even the small ones. So that's 26 neighborhood branches and the central library. And what's great is that we are almost open all of our pre-pandemic hours. And we're getting very close. So if I have the next slide, what we have is starting on January 6th, January 6th, we will have all of our branches at either 6 days or 7 days open. Some of the smaller branches are at 6 days. And that's what they were at pre-pandemic times. Those are branches like Montlake, and on the slide you'll see a picture of the Montlake branch, and it happens to be one of my favorite branches because the lower picture on the slide shows a great art piece that's at the Montlake branch. You'll see 5 circular discs. And these are discs that are cut into the ceiling. And what happens is the sun, as it moves across or appears to move across the sky, creates these wonderful images on the floor of the library and marks the spring and autumn equinoxes. It's a very cool art piece. So when you want to get out and about and you're close to Montlake, go on a sunny day and see this art piece, which is called Skylight Aperture Sundial. I just had to give a shout out to this really cool art piece. So many of the larger branches will start being open 4 evenings a week. Now they're open on 2. Every branch is open on Sundays. And, the Central Library is a little bit different. It's a very large building with 10 public floors. And or 9 public floors, and it requires a lot of staffing to make sure that we have staff at our information desks and our circulation desks. So there's still a little bit more delay on opening all of the floors and opening 4 evenings a week. So on the next slide, I want to encourage everybody to check in with their neighborhood branch on the specific hours because things change. So you can go to our website, which is spl.org. Road to Reopening, and you will get hours on all the branches. You can phone our quick information. That's the information staff. The staff those phones all the hours that were open at 206-386-4636. Or you can connect with us electronically. You can email or live chat with library staff. So the folks who answer the phone, the information staff, they are really, really knowledgeable. They answer thousands of questions a month. And what's really good about them is if you need help with any of our electronic digital resources, like our ebooks or streaming movies or digital newspapers and magazines, they're amazing. They can help you figure out how to set up your phone or your computer or your tablet. They are really skilled at helping you do that literally over the phone. So can I have the next slide? So on to new things. I always like talking about some new cool things at the library, and this is one of my favorite. It's called the Story Dispenser, and it literally is, as you can see the picture on the screen, it's a tall tower, and you can walk up to the tower and ask the dispenser to give you a 1 minute, 3 minute, or 5 minute short story. And the dispenser will just spit it out for you and print one out for you. Anyway, this tickles me a lot. And it was developed by a French company. And we have one of the dispensers at the Central Library, and we have one in the community at the Station Coffee House at Beacon Hill. So if you're close to either of those places, try that out. It's a lot of fun. The next slide, please, is our most popular collection. It's called Peak Picks. And what happens is we buy hundreds of copies of in-demand fiction books and nonfiction books. And we know they're in demand because we have a lot of holds on them. And basically, in every branch, there's multiple copies of, 25, 30 different titles at any one time. And it's first come, first serve. You just walk into the branch and you see, oh, that looks like a good book to read, and you check it out. So you can't place holds on those copies. And it's really about kind of discovering some of those titles that you really wanted to read, but you just haven't gotten around to. So on my slide, I have some book covers of some of the recent books that are in the Peak Pick collection. And one of them that I'm really looking forward to reading is at the top. It's a black cover with white lettering. And it's called Flying Blind, The 737 MAX Tragedy and the Fall of Boeing. The author is Peter Robinson, and this was just recently published. He's been doing lots of interviews. I just heard one on Terry Gross on NPR on her program, Fresh Air. And it's all about the changed culture at Boeing, which allowed at all levels for the company to cut corners. There's another book, also, it's a red cover. It's called Crying in H Mart. It's a memoir by Michelle Zauner. So H Mart is a supermarket chain specializing in Asian food. And the author, Michelle Zauner, kind of reconnects with her mixed cultural heritage through talking about food and the role of food in her Korean and American white family. So could I have the next slide? And talking about books, we also have a low vision book group. It meets monthly. It's run through our department called LEAP, which stands for Library Equal Access Program. And the goal of that program is to make sure that everybody has the right equipment and the right accessibility software to access the library's collections and services. So the next book group is December 14th, and the specific book is called Dutch House by Anne Patchett. She's a wonderful contemporary writer, kind of focusing on all the complexities of family relationships. It's a very sort of intelligent book. So the way the book runs is via conference call. So contact me at, and here's the email, leap@spl.org to register for that. And just, could I have the next slide? That one of the other more popular services at the library is our hotspots that we lend out. So for hotspots, for those of you who may not know about them, it's a way to give you internet access. It's a small little piece of equipment, bigger than a smartphone. Hotspots, you can check on the inside of the computer, just like a parent. And you have instant internet access wherever you are. So it's extremely popular. We have over 800 hotspots to check out to people. Right now, when I check, we have about 1,000 people waiting on hold, but it'll go really fast because we have 800 of them. And then the next slide shows another service that we have called Museum Passes. And these are, I think, services that people might not think about when they think about the library. So we partner with many of our local museums to offer a free pass for a visit. And right now, we have 6 museums, including the Burke Museum, Museum of Popular Culture, Museum of Flight, National Nordic Museum, Seattle Aquarium, and the Wing-Lift Museum. And basically, you go onto the library's website. You do need a library card. You go to spl.org/museum pass, which is one word, and you try to snag one of the passes for these museums. Now, the tricky part is that there is only one pass per museum per day. So you have to be strategic about trying to get one of those passes, trying to snag them. And the picture on the slide is a cool canoe boat from the Nordic Heritage Museum. And the lower picture is a picture of the International District and a neighborhood tour from the Wing Loop Museum. So could I have the next slide? And now, of course, something that I think most people think of when they think of the library is our programs. So we have some cool December programs. They're all virtual still at the library. And the library has had a great partnership during the pandemic with a local arts organization called Silver Kite Community Arts. And we've offered programs, 1-hour programs in visual arts, dance, writing, theater, and no prior experience is needed for any of these programs. You'd register through the library's online calendar, which is spl.org/calendar. And in December, we have some totally fun Silver Kite arts programs coming up. Bollywood dance is the most favorite program that people have over the last 20 months. It is completely high energy, and it is so much fun to go to it. I've been to a couple of them. We have senior social hour, and we also have dance and music programs for people living with memory loss and their care partners. And those are a combination of dance and music programs. And then for the next slide, I found some great, what we call digital creativity programs, which, and this month, they are on digital photography. So there's a program on designing your photograph on December 3rd, and another one called travel photography that's on December 10th. So that seems like really good timing for people as they travel during the holidays. I know that I've signed up for them because I definitely need help with my photographs, for sure. So again, you register through the library's calendar. And for any of registrations, if you're having any trouble registering, just call our quick information line at 386-4636, and they can help you with the registration process. And my next slide is I just want to encourage everyone to visit the older adults pages on the library's website. It's called Next Chapter. And we have lists of our programs. We have book lists. We have web resources. We have blog posts and other things of interest to older adults. That URL is spl.org/nextchapter. And finally, I encourage you to contact me at my email address is on the slide at nancy.sloat@spl.org. I'm happy to talk to you about our programs and any ideas you have for programs for services, how the library can be responsive, what your experience has been at the library. I also just want to say another true thank you. I'm retiring at the end of the month, and we hope that we know that the library will be involved in this partnership, and there will be somebody to take my place. So I just have had a really, it's been a great experience for me to work with all the folks at Age Friendly and to be able to really talk about the library and all its wonderful services. So thanks a lot, and thanks for giving me time to do the library update.
Wow, Nancy, that's some news. Thank you for sharing it with us, and you've truly become part of our family over this time. And too bad we were supposed to do, like, if everything went the same way, we would have done all of this in the building at the Central Branch, right? Instead, we did one event that way.
Yep.
I guess some silver lining is when you move on to your, different pastors, Um, we're going to continue these events in more of a hybrid format. So since there will be some kind of a virtual component, you can still join us wherever you are in the world.
I
And
like that.
so you'll see what's become of it, in other words. Not through somebody's account, but you can be there yourself. So that we'd love to have you back as a guest, as an attendee. All the best to you in whatever is next, Nancy. Thank you so much for everything.
Yep. Thank you, Lenny, and all.
Yeah, yeah. And if there's any questions for Nancy right now, please put them in chat again at the bottom right of your screen. Click the speech bubble. You can put in your questions. And please go ahead and use the translated captions if that's helpful. Thank you, Nancy. Sending you over to the green room now. And moving on to our next section, which I'll make it really brief here today. As many of you probably heard all over the news, there is a new variant of COVID-19, the Omicron. I think I'm saying it correctly. That variant, it's presumed that it's here in Washington. It's not confirmed, but it certainly is in the United States already. So what our health experts are telling us is vaccination and other mitigation measures like face coverings are still as important, if not more so than ever. And so for resources related to that, or if you have questions about the new variant, I want to invite you to visit kingcounty.gov and then click the first link that shows up for COVID-19 on that page. We'll put a direct link to that in our chat here on the live program. You can also call the statewide health hotline for Washington State. It's 1-800-525-0127. If you have questions about, again, the new variant or the eligibility for vaccines, and more importantly, boosters. That's something that I think is going to become important with this new development in our fight against COVID. You can also text the short number 438-829. Just text them your zip code, and you'll immediately get some locations that have the vaccine in store. As you know, the eligibility has been extended to kids from 5 to 11 years of age via the Pfizer vaccine. So what's on the screen right now is as of the 23rd of November. They're talking mostly about boosters, which you have to have 6 months past your second dose of Pfizer or Moderna, or 2 months from your dose of Johnson & Johnson to be eligible for a booster. And you have to be 18 and over at the moment for that. So yeah, we hope that you check out this resource. But if you have any other questions related to aging or disability, there is a network of organizations in Seattle and King County called Community Living Connections. It's a group of organizations that are contracted with the city of Seattle and King County, and they're all around, in our neighborhoods. And so one way you can do it, if you know one organization, you can walk in and see what services are available. If they don't have something that you're looking for, they can refer you to another organization and network. You can find that all the locations by going to communitylivingconnections.org and looking at the map and listing of organizations, or they also have a hotline. 844-348-5464 is the toll-free number. You can call a community advocate and they'll do a very brief kind of questionnaire for you and then let you know what kind of resources are available, like food, meals, rent assistance, that kind of thing, anything really related to aging and disability. So please use this resource. Please pass it along to somebody who may not have heard about it just yet. Thank you very much. And with that, I would like to move finally to our main event here. What I'm going to do is I have a bio here for Marwa, who is on your screen now. And I will read that to introduce her. And then when Mohammed comes on to talk, I will just ask him to introduce himself. So Marwa Sadiq was born in Iraq and raised in Syria She arrived in the United States at the age of 16. That's very similar to I came here. I was almost 17 myself, so that's really awesome. Marwa holds a BA degree in education and currently pursuing a master's in international studies at the Jackson School of International Studies. She has more than 10 years of nonprofit and community organizing. Marwa joined IRCCW in 2009, and currently she is the program manager and operations director. Marwa was involved in the White Center Early Learning Team in 2005. Prior to working with IRCCW, she worked for White Center CDA, Refugee Women's Alliance, REWA, Southwest Youth and Family Services, and Highline School District. Very familiar with REWA. I'm actually one of representatives for King County on the Refugee Advisory Council for Washington State, and so we have folks on that board from REWA and actually from Highline School District. Uh, Being an immigrant makes Marwa understand the journey of struggle faced by immigrants and refugees to adapt not only to a foreign language but also to a new culture. What drew her to join IRCCW was the opportunity to contribute in a direct way to ease the struggle of refugees and immigrants in the Seattle area. That's such a wonderful introduction. Thank you so much for being here, Marwa, and being here on our very final episode. One of our colleagues, Gira Hammam, who you get to see a little bit later, is connected with this organization and has helped us make this connection. So, really great and meaningful to have you here. Please take it away, and Mohammed will introduce you here in a moment.
Okay, good morning, everyone. Thank you so much, Lenny, for the introduction, and thank you for the invitation. I'm very excited to be here. And to start with the organization background, the Iraqi Community Center was actually founded in 1998, and I think that's on the next slide. Um, it was started by our current ED, Yahya, who's also the founder. He arrived into the Seattle area after the first Gulf War with other refugees who, left Iraq and were staying in a refugee camp in Saudi Arabia. So they came to Seattle and, they felt very isolated. There was a huge need for services. And at the time, many of the direct service providers did not provide services for Arabic speaking families or in Arabic. So in the time, they were ready to apply for their citizenship, they didn't find any or any ESL classes. So they contacted City of Seattle, Seattle Central at the time, and they were able to start their very first program, which was the citizenship, and that's kind of like how the organization started. And then we actually had an office under the umbrella of Southwest Youth and Family Services in West Seattle until about 2001 or 2009. I think that's when our office, we moved to Kent because, there was a second wave of refugees in about 2009 until 2016 or 17. So basically, at the center, we provide culturally and linguistically services to Middle Eastern, Arabic speaking, mainly Iraqis, but it's open to everyone who comes to our door, and we have a larger community that also contact us from Tri-Cities, Bellingham, and other cities in Washington State. At the center, we try to be a one-stop shop for our clients. So our services start, from translation to finding housing, to much more services. And I think we can move to the next slide. Yeah. So our mission as an organization, and we can start with the vision or something on. Okay. So our vision is to promote empowerment to Iraqi refugees through capacity building. That's where we provide a lot of workshops and know your rights workshops or community members. Who do we serve? Arabic speaking individual and families in South King County and Seattle area. Our mission is really to promote community empowerment, leadership development, self-reliance, and health promotion for newcomers to achieve self-sufficiency and economic independence through direct service and assistance and capacity building. We can move to the next slide. Yeah, so our programs, again, we have a large case management, there's the referral, mental health awareness. I think a lot of times, there is a misconception about refugees that, when they come to the state, they really depend on the system, but that's not true. A lot of our families who come to the state through their resettlement agencies, they are connected with their case manager through that agency for 90 days only. And after that 90 days, they're basically on their own. They have to find a job, they have to register their kids to school, and they have to navigate the system. And we see sometimes for people who are born here, it's very hard to learn about the system and navigate it. So, imagine for refugees who come with a lot of trauma, who come from a whole different system, to, learning everything and being on their own. So basically, after that 90 days, that's when the community starts to come to our door and we walk with them, step by step. We help them with, if they need to renew their green card, if they need case management, making doctor appointments, their mental health at the time, especially if they have youth or children. That's also where we step in, and our case managers would help them with, just whatever they need, from basic needs to other services. And the next slide.
Thank you for giving me this opportunity to join this morning. I believe I would start my name is Mohammed Akmouche. I use he, him pronouns. I am raised and born in Iraq and studied in India, Turkey, and then moved to the US in 2016 as a refugee. I'm a parent of 4 kids. I moved with my family in 2016 here, and my first step was with the Iraqi Community Center of Washington as just a new arrival coming to ask about how to navigate all this new, not only system but new life. With the responsibility of being a father, of how is this life going to be like in this new setting. So my first step was at the community center, just coming, asking for support to just see how to start with things like basic life issues like job or just education or just registering kids at school or things like that. These kind of simple things that can be taken for granted by any one here, but for a new arrival, these things are really overwhelming. Just, the beginning is very difficult. I think it's something common for like to start anything is overwhelming. Just thinking about like what's next, how to start, things like that. So navigating, I believe, is not just a word. It's just it's a lifestyle. It's everything that you think about. Coming into the community center and seeing people speaking your language, look like you, and welcoming you in a way that feels like home, that make the process really easy. Um, and that's what's unique about the Iraqi Community Center. We are, I can say safely, we are equitable representation of our community. We are not professionals just working in the community. We are from the community. We look like them. We support them in their language, and we experience their like their challenges. We are on the same page in terms of we don't need like to, like we are experiencing these issues on daily basis, just like any other family. So all of the professionals here, whether like from Afghanistan or Iraq or other professionals that are working with the Iraqi Community Center of Washington, are authentic, organic representation of the community. So we build this relationship. We build the trust with families, and we support them and guide them in partnership through our programs. And that's how I can say we can start introducing just a little bit about our programs at the Community Center, starting with the Arabic School. I think one of the amazing programs that have been established by the Community Center is the Arabic School, because like one of the main concerns for parents is just to keep their kids sustaining and keeping their identity. And the first thing with identity is just language and culture. So one of the challenges is, like as parents we face is like, I need my kids to stay speaking just like me. My home language should be there also. Spending like 8 hours at schools and picking the language so easily, and then like choosing the preference of English, other like and forgetting about home language is just something that, as a parent, I feel like this is a challenge coming among parents here. So we in partnership with volunteers, families, and professionals at the communities started this project. And it turned to be really successful community project. And we were holding it like on weekly basis. We rented schools from Kent School District, Kent Phoenix Academy, Kent Meridian High School, to establish this program, and we did it like on weekends. And then once we announced it, like hundreds of students came in to the program. People are registering their kids and trying to, this was one of the successful projects at the Community Center. And due to pandemic, everything shifted to virtual. So one of the things that shifted to virtual is the Arabic School, and hopefully when things improve, we'll get back to in-person, seeing our kids, enjoying the language, enjoying the culture, joining our volunteers, teachers, and staff. That's one of the exciting programs. Also, if we can move to the next slide. So this is like one of the pictures of our kids at the school. And moving to the next slide also, that is the ESL class. So as someone who started his life, I have the privilege of speaking English before even I come here and learning English. That's one of the things that I feel like I am lucky to have it. But like this is a challenge for many parents, and we are seeing it in the community. So language is a big piece when it comes to access to jobs, access to services, access to anything around us, and it keeps people like behind and falling into cracks just because of that. So we, in partnership with Highline College, to establish ESL classes by someone from the community. Like the teacher is speaking Arabic. One of the amazing things that we do at the community center is the ESL class. That was also held in person, but then also shifted to online because of the pandemic. And it's one of the things that we hear really great feedback about it, because people love the way we do customize and adapt this program and this class to families. And we welcome everyone to join this class, not necessarily speaking Arabic, only Arabic speaking, limited English speakers. Yeah. Moving to the next slide, please. Yeah. So for this program, one of the programs that keeps people engaged and advocating for kids is like early learning department. We have two programs that are involving parents, moms, and that partner with other parents and involve them in the process of advocating and educating their kids to prepare them for the school. So this program, what's unique about this program is it's a partnership program, like professionals coming home. And also due to pandemic, it's most of it turned into online. Coming home, work with families, establish plans that are based on their choices, based on their goals of how to support their kids, and also to support the parents. And this is like culturally, we are looking at the whole family. We cannot work with kids leaving parents behind, and that's what's unique about this program. We look and work targeting the kids, but also support the parents, because that's part of the program. Yeah. If we move to the next slide, please. This is Sausan with the kids graduating from the school, one of our professionals at home visiting program for 0 to 5. Yeah. Moving to the next slide, please. Youth. So yeah, for this program, like we have a team that works with kids to provide after school programs, to also work with youth to support them with the school system navigation, graduation requirements, things like that. So it's working with youth in multiple ways and capacities to support them, to prepare them for whether college or employment life. And the unique thing about this program is it's led by youth, and all the professionals are among our families, youth who are experienced the same journey. So they are partners with the youth to guide them through this process. Yes, please, next. Yeah, this is a wonderful picture of one of the kids, like gatherings at after school program. So next slide, please. Yeah, so one of these like programs is our women support group. So we used to have programs to provide like social emotional support for ladies, and this is kind of led by Marwa and other professionals at the community center. That's like also it's shifting to online and social media groups and things like that, and um, like presenting the support as on ongoing basis. Um, moving to the next. This is one of the gatherings of the families, and what is wonderful about the Iraqi Community Center of Washington is these events that we really miss these days due to the pandemic. And we had wonderful events that, like where hundreds of people turn out. Like one of these unique annual events is iftar events that's held in Ramadan, where we choose a church or like a bigger place to invite families to have an iftar after fasting the whole day in one of these days in Ramadan, and gather families to practice these social practices that we used to have in our home countries, and that was like really wonderful. Um, multiple annual events that we hold, cultural events and family gatherings, and that's ongoing base. It's ongoing, but right now, due to the nature of the pandemic, we try to limit these gatherings. Next, please. So in terms of advocacy and leadership, this is one of the really great focus areas at the community center. So we identify goals that we want to, work on as a community together, and we bring voices of people, prominent leaders in the community. We consult with parents, kids, youth, and hear voices and gather feedback to, work on specific issues that facing our community. For example, one of the themes that come up usually is like communication with stakeholders at the city or around us, like the services are um, inaccessible in a way because of lack of language support, or culturally presenting the service that is in a way adapted to fit our needs and our like community nature. So we call for as the Iraqi Community Center, we call like all stakeholders at the city and leadership to promote well-informed community in a way to support clear communication with families, in language support for services, like all these forms that you hand out to people, to parents, whether it's at school, clinic, or any other services. Please try to make it accessible by providing a translation or interpretation. Also, we advocate for equitable representation. For example, we want to see diverse staff at leadership or at anywhere at the city. So we want to see we call everyone to hire diverse population, whether it's Arabic or other cultures and languages. That's for the benefit of the whole community. And this is a kind of smart investment that can be done by any leadership to promote inclusion, diversity, and equity. And these can be done through partnerships. Like just this program, I believe this is one of the things that can promote, just being listening to other voices and other opinions can promote these kind of values. Yeah, that's what I can say in terms of advocacy. If we move to the next slide, please. This is one of the wonderful senior gatherings. So the next slide is talking about senior program, which is, for me, I believe it's one of the successes at the community center that we celebrate usually, because we provide this culturally tailored program that focus on social, like to avoid social isolation, and social engagement is one of the key goals of this program, is just to keep our senior engaged, and having these kind of gatherings, and focus also on their wellness and whole being, and the values of good health, good nutrition, connecting them with the professionals, bring the professionals to their space, and provide these kind of interpretation, language support, like building this trust and partnership with other stakeholders in the community. So that's one of the wonderful things that we do at the community center. Also, due to pandemic, most of these meetings are now on online virtual world, but we do make sure that everyone of our senior group is having access to this virtual world, and we train and partner with them to move them to this difficult virtual world. Yeah, next slide, please. This is what we talked about, and I think also we can move to the next slide. This is one of the wonderful gathering of women groups and families also. So if we move to the next slide, also housing is one of the big issues that we face at the community, because most of the families that we work with are severe low income, and housing is very expensive, like service, and it's a big challenge. To be honest, it's one thing that we hear usually from families as the biggest challenge that they face. So we work with families to attain a stable housing, and that's through our programs, whether it's homelessness prevention or other emergency programs that we through which we provide services that include like case management support, identifying challenges, working in partnership with families on these challenges, employment, services, education, other things that can be, obstacles to families to sustain stable housing. And also we provide financial support for families to prevent homelessness, and to keep families under a safe roof. And also just to make sure that we are for housing, we are serving anyone, not necessarily Arabic speaking families, and in most of our programs, that's nature of we have a policy of open doors to everyone, so everyone is welcome to come to our space and ask for support. So I think to conclude, I would give it back to Marwa if she has any additional things to comment, or if we missed anything that's related to our wonderful programs. I appreciate this opportunity to be here in this space and present to the public for about the Iraqi Community Center. Thank you so much.
And thank you so much for being here in such a short notice. Thank you for a wonderful presentation, and for sharing these resources with us, and for making it personal and showing these wonderful pictures. We're running up right against our end time here. We have about a minute to spare, literally. So I'm going to ask, and this is why, spoiler alert, in 2022, we're going to make these events 90 minutes so that you still have the same amount of time to present, but there's more time for interaction, especially since we'll have an in-person component. So people will actually be raising their hands. We'll be passing around mics. So What I'm going to ask my panelists now is, are you able to stick around for maybe another 5 minutes to answer a few questions? Can you stay? Awesome. Thank you. Well, those of you in attendance, I want to respect your time. If you have to get going at 11:30, you'll miss my, mic drop moment that I'm doing later and kind of talking about 2022. But if you can stay, please do, because we are going to now go to questions. And I would be remiss not to introduce, you see on your screen here, my colleagues. They're working hard in the background. Gita Hammam, Meg Wolf, and Michael Tiller. Judd Michael is monitoring there on Facebook. And Meg has been putting in all the different resources that you see come through here in the chat as well. But Gita, I mentioned you earlier. So Gita is a program intern here at Aging Disability Services at Age Friendly Seattle from the University of Washington. And she has been connected with this organization for a while, and she introduced us to it. And thank you so much, Gita, for all your work, but specifically for making this program a reality. So, Gita, what questions or comments do we have here in the chat box?
Yeah, so thank you so much for coming. We do have some questions. One of them is a comment from Irene, and it says, "Your work is impressive, and I wish you every success in the future." And another question.
So much for this compliment.
Go ahead.
We appreciate that. We appreciate every support, like whether it's just a comment or anything that can support our work. Thank you so much for that.
And another question is from Mary. "Thank you for sharing your experiences and community." And she's wondering, how has the pandemic impacted your work and community, and how are you recovering?
Yeah, thank you. I think I can answer that question. I think with the pandemic, has shifted everything within our society. So we really focus from transitioning and adding services that address the needs of our refugee community. There was a lot of isolation, as Mohammed mentioned, but even with the pandemic, there was even more isolation. So, at the center, we responded to, people's needs. There was a lot of need for food assistant, rental assistant, and medical assistant. Also, the community, at the time, they didn't know what was going on. There was a lot of news, a lot of it was confusing. So we were able to provide, COVID-19 information in Arabic for them. For the seniors, I think we were able to give about 50 iPads, and we trained them on how to use these iPads, and we kept meeting with them on weekly basis, and they were able to connect with their family back home. Isolation and stress was, a big issue that the community was going through. So everything shifted, online, but we were able to provide, like our staff, that the whole world was, shut down, and our staff were just like, running in our minivan, delivering diapers, food, and other basic needs at the time.
Great, thank you so much. I do have one more question, and I was wondering, do you plan on hosting any religious events for Ramadan and Eid next year? I know COVID has impacted that. So I was wondering, have you planned anything for the coming year?
Yeah, it's a great question. I know everyone asked, about the events we were holding. Again, as Mohammed mentioned, we had, amazing events of more than 300 people showing up. And then every time we plan for an event, we have to look for a bigger space because it's not only for Muslims or Arabic speaking, but we also try to bring, the mainstream community to come and learn about our culture, their neighbors, and, share a meal. We had a lot of like teachers and counselors and doctors who were interested in attending to learn more. We are planning an end of year event on December 18 at Cape Meridian High School to give away like toys and cleaning supplies for our families. And for Ramadan iftar or Eid celebration, that's kind of still on hold. We're just gonna see the state regulations, and a lot of our community members are vaccinated, but not their kids. So we have to take that into consideration. One thing I wanted to add, for those who might be interested, I forgot to mention that at the organization, we have about 15 staff members for all of our programs, and most of our programs come from the community themselves. So we usually have a lot of surveys, we do a lot of focus groups, and we ask community members about what kind of things they want to see. So that's, how our programs come to be.
Awesome. Thank you so much for sharing. And we do have one more question from Dinah, I believe that's how you pronounce it. Thank you for this presentation and for your work. You mentioned that you did some training with older adults to help them move into the digital world during the pandemic. Can you share any more details about the challenges you faced and how you approached those?
I think just shifting into, everything being digital was tough. The schools at the time gave laptops to families, but, a lot of our families didn't know how to use it. They had trouble time, with passwords. They couldn't connect with staff members at the school. So that's kind of where we come in. We use an app. It's called WhatsApp. I don't know if everyone is familiar with it. It's a free app that almost everyone we know in the community use it. It's a free app. That's how they connect with their families back home. So basically, that's how we were connecting. We would FaceTime and go like step by step on how to use the Zoom or how to use the laptops. And everyone's job at the center, shifted to being a case manager. So everybody was, doing direct service, at the time. I don't know, Mohammed, if you want to add to that or if I covered the question.
You
It's
you
mine,
mentioned
yeah.
so, but I just if I wanna add something, is just it's we think about access, whether it's just like access to the digital world or anything that's being in consideration. So we try to simplify everything that we do, and try to make it simple for as Marwa said, WhatsApp. We use it to send just the link, and then click on the link. We call families. We give kind of like in language instructions on very basic things that they can see as a big challenge. I think these we take everything into consideration, whether it's just a basic challenges or simple instruction of how to use this. We try to set up every device that we give to families. We help them with every simple process. So we try to be mindful of these challenges.
Yeah, we create groups, like we would add all the seniors into one WhatsApp group, and we send events, information, and sometimes they communicate with each other that way too, and they find it very helpful.
That's wonderful. Thank you so much for all the work you're doing. I think that's it for the questions. Lenny did mention that WhatsApp is very popular in the former Soviet Union, so that's really good to know. And I'm just going to hand it back to Lenny.
Thank you very much, Geeta and Marwa and Mohammed. Really wonderful to learn about your organization, and I'm very honored that you are closing us out on Close to Home. Sounds like you have been making it close to home for folks, helping them with transitioning to digital and even making gatherings and celebrations virtually. And hopefully we can hybridize it more, if that's a word, moving forward. I certainly look forward to it. And thank you again for being here. Please don't leave yet. Please stay in the green room. We'll check in after the program is over. But at this time, it doesn't look like there's any questions for Nancy at the library. Is there? No. Okay. I'm getting a signal that there's not. Well, thank you for staying, Nancy, and thank you for everything that you do here at the library. I'm gonna land the plane, so to speak, and actually, I thought about what would a mic drop moment be like for this program, for Close to Home, Stories of Health, Tech, and Resilience, and that is introducing what's coming next. We love that you were here today, and thank you for sticking around even beyond the end time. This was the 34th and final episode of Close to Home. It's in the books, but now here's what's coming next. The program that you are part of today and its sister program, the Civic Coffee Hour, which used to take place on the third Thursday, and that's been the case for like 15 years now. Those will now be combined under the same name, and the name will be slightly different. It'll be just Civic Coffee. And it will still take place on the third Thursday, just once a month. And rather than an hour, this is why it's no longer coffee hour. It's going to be a full 90 minutes, using the term from our friends at the Seattle Sounders. And it will feature both government officials, like Coffee Hour has done forever, and community leaders like Marwa and Mohammed and Yahya in a panel format. And that we really look forward to that. There is another exciting difference, and that is that we are transitioning into a hybrid format. I mean, COVID is still here, but we have better tools of fighting it, like vaccines and boosters and other things that we've learned. So we want to. The dream is to continue welcoming some of you still virtually, while others can begin joining in person. And you know what that could mean? That could mean coffee and donuts, and specifically at the Central Library, which will be the main location. But also possibly other branches. We'll have to check in with SPL about that. Community centers, senior centers, cultural centers, really any other gathering place with an internet connection, big screen, and some chairs. Really, that's what we need. Donuts, coffee are optional, but certainly encouraged. And our panelists will also have the option of joining in person or virtually. The goal really is to welcome as many voices into the conversation, especially voices of our elders, as possible. But regardless of physical locations, I was mentioning for Nancy, wherever she is in the world, she can possibly join us later. So I would like you all to save the date. The online portion, like I said, there will be some in-person components, but the online portion will always be found on the same link that you used to join today, which is bit.ly/HFriendlyLive. Each of those words is capitalized. And also there will be phone, Facebook, and probably YouTube options. And by the way, if you haven't already subscribed to our YouTube channel, please consider becoming an Age-Friendly champion. That really helps us grow. And we're at Aging. You just search for Aging King County on YouTube, and you'll see it there. Give us a sub. We would appreciate it. And last but not least, Community Living Connections. I never get tired of talking about it. The reminder is that they're available at 1-844-348-5464 or at communitylivingconnections.org. Capitalization not important there. And this is it. This is the very last one, and I promised the mic drop. There it goes. There, we got to put it in frame. All done on the Close to Home. Thank you all so much. We appreciate all of you that have joined and have been here over time. Thank you. You're a family to us, and we'll see you in the next year. Take care, everybody, and enjoy the rest of your day.